There is a well-known link between obesity and the development and progression of numerous tumor types, but the underlying mechanisms are not entirely clear. We've had a long-standing interest in the link between inflammation and cancer in general, and a more recent interest in the link between obesity, inflammation, and cancer. So our study is specifically to evaluate the role of inflammation in mediating the effects of obesity on cancer. Inflammation is known to be important in the pathogenesis of obesity-related diseases. So inflammation of fat tissue has been linked previously to both diabetes and heart disease, and we're the first to formally test the role of inflamed fat in cancer. From the standpoint of inflammation and cancer, there are many studies demonstrating a link between chronic inflammation and the development of cancer, inflammation and the progression of cancer. We are the first to connect inflamed fat in the context of obesity and cancer. We have carried out a number of studies which illustrate many important aspects of the obesity-cancer connection. We have linked elevated body mass index to fat inflammation in the breast. Also, we've recently reported that postmenopausal women are at increased risk, independent of their body mass and having breast inflammation. And we've just demonstrated that the metabolic syndrome is associated with breast adipose inflammation. In work that was presented here, we've demonstrated that this is clinically important. In a retrospective study of 127 women, we've been able to demonstrate that recurrent disease-free survival is affected. That is, women who had breast inflammation at the time of diagnosis, and more specifically fat inflammation, had a shorter time to recurrence than women who didn't have inflammation in their index mastectomy specimen. So it appears to be clinically important. What was very surprising, and I think is very important, is we also identified about a third of normal-sized women, that is normal BMI women, who have occult breast inflammation. And the question for us became, is that clinically important, or is it merely a pathologic finding? And we found that these women also were metabolically perturbed. For example, they had what we call insulin resistance, and that having high levels of insulin has been shown to increase the risk of breast cancer. So it is quite likely that adipose inflammation of the breast, which is a sentinel for more diffuse adipose inflammation, underlies the insulin resistance and could help explain the link between having high insulin levels when you're normal and increased risk of breast cancer. There is a very large segment of the population who have adipose inflammation of the breast. That's about 50% overall, but about a third of so-called normal BMI women also appear to have this process. And currently in a doctor's office, you would get a pat on the back, job well done, because you have a normal BMI, which leads to a sense of confidence. Our data argue that, in fact, there's a large reservoir of unrecognized disease, and we're all familiar with the fact that there are many lean individuals who years later show up with type 2 diabetes, heart disease, or cancer. So our data suggests that much more attention needs to be given to occult adipose inflammation. We are actively working on developing treatments for this process. So if adipose inflammation is tied to numerous diseases, including multiple cancer types, the question becomes, how can we treat this? And we are carrying out preclinical studies thus far, but we have some example of success. For example, we can reverse adipose inflammation in an obese animal with caloric restriction, so that is encouraging. And we're of course also interested in developing drug interventions.